Hi, can you hear me now? Yes? Okay, good. So what I was saying is thank you all for taking the time to be here. I know for a lot of you, you were just with us for the last hour. So thank you for joining us for 2 hours today. This is the meeting to talk about the community behavioral health relief funds. And before we start, I just have a few housekeeping items to talk about. So please, if you are not speaking, stay muted. You can ask questions in the chat as we go through. We are not going to stop periodically and ask if there's questions. We're actually going to go through all the slides first and then do questions at the end. But if you think of things, go ahead and write them in the chat so that you don't forget. This meeting will be recorded for future viewing, and it will be posted on the Healthcare Authority provider and contractor resources page. Because it's being provided, it is public record, so just be careful that you don't disclose any personal information that you don't want people to hear. And the slides will also be posted on the behavioral health provider and contractor page after the meeting is done. That's all. Welcome.
Well,
are we on to me first?
There you are, Carrie.
Jason, and I kick it over to you.
There you are. Good.
So yes, hey, it's good to see everyone. And as you just heard, you're going to hear some welcomes from me and Jason and Michael, and we are going to talk everybody through this. You've been hearing from us, providers. You all have been hearing from us for a while. It's coming. This money's coming. But before we get into kind of like the real stuff that you want to hear, I'm going to do my due diligence as a leader and just say some thanks to a freaking slew of people. So welcome to providers. I think that you all know this, but it goes far, I hope, to hear it again. We appreciate you all so much. Without your tireless work leaning in during legislative session and really talking about the workforce needs that you have, we certainly can't do this alone, right? And so without your tireless work to be amazing behavioral health providers, you also did amazing work and tireless work to say, we have workforce challenges. We've got, things that really, really are needed, rates and other things. And we're here to talk with you today about those other things. But thank you for sharing those. Thank you for doing it in an organized manner. Thank you for doing it in a manner that helped us help you to elevate this need up and get this $100 million in provider relief fund going out to all of you. I also really want to thank the governor's office. I think we know that they worked really hard on getting the money into the governor's budget, as well as really helping to shepherd the provider relief funds through and work with the next group of folks that I want to thank, which is our legislature. As many of you know, we have seen unprecedented amounts of investments in behavioral health these past few years, and it just will continue. But the legislature heard all of you saying, we are having some major issues and we need relief. And last thing I wanted to let folks know before I hand it over to Jason is that our staff in Healthcare Authority have been working to implement over 130 behavioral health specific budget provisos this biennium. And we in Healthcare Authority heard you loud and clear that this needed to be prioritized. And so this work toward providing relief to stabilize and grow treatment capacity across the state was prioritized. And we really look forward to giving you information today. I'm going to just thank some key staff before my Oscar acceptance speech music goes into effect. But so that the providers really, so that you all understand, this took people from our finance team, from our enterprise technology services, from our legal team, which includes our contracts, from our communications team, from our Office of Tribal Affairs, from the Medicaid Programs Division, hey, Jason, and from DBHR, right? So all of the teams have worked collaboratively to plan for this and to implement this work and to get us here today having a meeting to talk with all of you. And a special thanks and recognition to two folks from Team DBHR, which is Kim Wright, our lovely professional welcomer who was telling you we're almost ready for this meeting. She also is really key in implementing all of the provisos in our legislative work and has taken on some great roles with that. Be looking more for her as she leans into her role, and Sandra Mina Tyree as well. Both of them have really led and coordinated this daily development of the work. And so thank you so much. So with that housekeeping bit and welcome, Jason, I'm going to hand it over to you to do some further welcomes and to really get us started.
Thanks, Carrie. And I really just want to echo that and welcome everybody and provide some additional context here to how important this is in comparison and in context to some of the other work going on. Particularly, as Carrie mentioned, workforce, how critical this is to, again, thanks to the governor and legislature for really prioritizing this funding. And really, it is what we are referring to as a bridge funding to a 7% rate increase across the board in Medicaid and non-Medicaid crisis ASO services starting in January. Because of our federal requirements with regard to rate setting, it is very difficult to increase rates on an off-cycle amendment. So January is the beginning for that rate increase. So the legislature and the governor, I think in their wisdom, took some of the sort of CARES Act, federal dollars, ARPA Act dollars to help fund this provider relief effort now, as soon as possible after July 1, which is the date the money is appropriated officially to the agency. And then, of course, we'll need some time to process this, and that is what I will introduce you very shortly to Michael Langer to talk about that process today. But again, in addition to that 7%, other work underway to really explore system changes, including our CCBHC work, our Certified Community Behavioral Health Center work, which we have also just begun. And I appreciate those who have also attended that last hour conversation. You heard about that. So the effort and investment you're making today, we so greatly appreciate, because all of this is not going to work well without you. So we need you and we need your voice, and we're here to listen today. I also want to mention some of the, again, workforce issues. So the public education campaign, working with higher education, working with our community to develop new ways to provide services such as certified peers, I think so critical right now. And we're continuing that work as well, particularly our DBHR shop. But we know we need to do all that to have a well-run Medicaid system for the 2.2 million people we serve in Washington today. So with that, I cannot thank you enough, and I cannot thank my partner, Michael Langer, enough, and Carrie. And Michael, I see we've got over 400 people on today to hear about this. Really unique and incredible effort. So Michael, without further ado, are you on and ready to go?
I am on and ready to go. Can you hear me okay, Jason?
We can hear you just fine. Thanks, Michael.
All right. Perfect. Thank you, Carrie. Thank you, Jason, Melissa, certainly Sandra and Kimberly as well. It's taken a large team, has already been stated. I have the privilege to go through and read a few things that you may know directly out of the proviso, and then give you some insight as to where we are in the process now. So give me just a few minutes to go through these slides, and then we will open this up to the questions that I'm sure you may have. And our number is up to 446, so a really good turnout here today. First of all, the provider relief funds were provided to the Healthcare Authority to address behavioral health treatment access resulting from workforce shortages and the COVID-19. I think if you can put yourselves on mute, that will help. Kim, can you still hear me?
Yeah, Michael, I muted participants. You're good to go.
Yeah, everything just went black here. If you can hear me, Kim, I'll continue, but.
We can hear you fine, Michael.
Okay, my goodness. Oh, I have 3 screens up, folks, and they all went black at the same time. Okay, so funds were provided to HCA during the 2022 supplemental community behavioral health budget time. We know that. And the funds will be put out in lump sum payments eligible to community behavioral health treatment providers dispersed before October 1. And so you'll hear a little bit about this. We will do this in we'll have one wave of money go out, and then if we have some providers that turn the money down, we will send out a supplementary amount shortly thereafter. And if you can go to the next slide, I'm hoping this works, Kim. I'm going to have you pick up because.
Are you seeing that next slide? I have moved on, but I'm happy to jump in if needed.
Yeah, Kim, why don't you? I literally, the moment I started talking, these screens all went black. So I'm apologizing.
No,
right
no
on
problem.
time, right?
So we're going to go to eligible uses for the funds and what the funds can be used for. The funds can be used for immediate workforce retention and recruitment. They can be used for childcare stipends, student loan repayment, tuition assistance, relocation expenses, other workforce recruitment efforts, and costs incurred due to the COVID-19 public health emergency. Funds are eligible to be used for costs incurred prior to July 1st, 2022 due to the COVID-19 public health emergency, and funds must be used for costs incurred on or before or on or after March 3rd, 2021. And then providers must also agree to expend these funds by June 30th, 2023. Please bear with me. I'm just operating my own slides and navigating my talking points. So one moment.
Kimberly,
Kim, I'm back. I could take on the next one if that helps.
Thank you.
I can, yeah.
Okay, we
Michael,
good?
if you want to take back over, yeah.
Okay, we'll try to get back at you. Sorry, it all came up again. So eligible behavioral health treatment providers include community behavioral health treatment providers who are non-hospital based and contracted and receiving payment through a managed care organization or a behavioral health services organization, a BHASO. So if you're a certified CBA and you're non-hospital based and contracted, you're in. Licensed as a BHA to provide the following: withdrawal management, residential and 24/7 services, outpatient treatment, and crisis stabilization, crisis triage, and mobile crisis providers. So those are the types of services that if you're contracted through the BHASO and MCO that would be qualifying here. Go on to the next slide. Ineligible behavioral health providers, and this was a tough slide to put in because obviously we'd like to share with everybody we could, but hospital-based behavioral health services will not qualify for these dollars. Substance use disorder prevention and mental health promotion, community wellness services, children's long-term inpatient, problem gambling services and supports, and recovery support services, including supported housing, supported employment, recovery cafes, and other non-treatment recovery services. So again, if you're not a BHA contracted through the MCOs or BHASOs providing treatment services, you will not be qualifying for these particular dollars. Next slide, please, Kim. Payment methodologies. Payments will be determined based on the number of people served by eligible providers during 6 months of 2019 and 6 months of 2021. Client counts will be estimated based on claims from provider 1, and HCA will use these revenues to determine the most equitable distribution methodologies for these payments. I want to come back to 2019 and 2021. That decision was made based on feedback from all of you, not all of you, but many of you. And here's the rationale related to this. Particularly on our residential or 24/7 providers, COVID has caused, as you all know, social distancing and issues in residential facilities where the capacity has shrunk, right? You can't have 2, 3, 4 people in one room anymore. And so the amount of people we can serve has come down. Therefore, we've chosen 6 months out of 2019 because that's when folks were at full capacity. At least that's the idea behind it. We also chose 6 months of 2021. There are those between 19 and 2021 that new providers came on board or new services began with existing providers. So we wanted to make sure that we didn't leave out the capacity side on one end in terms of what people were able to serve prior to the pandemic. And we also didn't want to leave out folks who brought on new services or new service providers. So that was the rationale of choosing both 2019 and 2021. And we will be bringing both of those time periods into focus when we look at the data. Let's go to the next slide, Kim. Okay, this is what many of you are on for today. When are we getting our money, right? We think we're in, but when do we get it? What's going to happen here? What's the process? So there's a two-step process. In July, first of all, I'd say in June. One of the things we've been saying for weeks now is we wanted to have a provider call in June. So we made it with 3 days to spare, but we are having a provider call in June to kind of tell you where we are in the process. In July, there'll be an opt-in request form to gather agency signatory information. You're going to have 2 weeks. So you're going to get notified and you'll have 2 weeks to fill out this form and get it back to HCA saying, here's all the particulars about who our signatory authority are, contact addresses, things of that nature. I think there may be some MPI numbers in there too. I don't recall everything that's being asked for, but we do need you to send that in with a 2-week period. After that, we will be looking at August for all those that said we want to opt in. In August, we will be sending out a contract containing the amount of funds to be received and funding requirements. Again, we'll have time-limited responses required on these. And then providers to behavioral health providers will be out prior to September 30. We really, really want these dollars to go out much, much before that. But we need to get your information in for those of you that want to opt in, and there are reasons folks don't want to sometimes. And then we need to get the contracts out. In the contracts, there will be language about what's required. One thing that I will just mention, I think it comes up a little bit later, is if you do accept these funds, you're also accepting the possibility that your agency will be chosen to be part of a survey later on. And in that survey, you need to tell us what specifically you've done with these dollars. So that's part of our report back. And anyone accepting the dollars will also accept the possibility of being chosen for that survey. Go to the next slide, Kim.
So we really have reached the point where we can begin taking questions. This slide exists to show you that we do have areas to go that will be continually updated on this contractor and provider resources. This is where we'll post continual updates and information. These slides and this recording from today for your future reference. You can email us at hcadbhrinformation@hca.wa.gov. But I'm going to back up to the process slide, and then we'll go ahead and take some of your questions.
Kim, I would mention also, I believe we're going to have a call at the end of July. So hopefully we'll be quite a ways along in the process, but at least at this point in time, unless it's not necessary, we will try to do a check-in again at the end of July, keep you informed. So back to you, Kim, to facilitate the questions.
Great. I'm going to call out some questions in chat, and I am just having a little bit of tech problems. I think many of us are, maybe from the number on the call or maybe just how Teams is operating today. But I'm going to offer a proposal for who will answer those questions, and please feel free to chime in as you can, those on the call with the expertise. So what would be the process to notify agencies in July? I see that this is asked in the chat, and the process will go out to emails that you have on file with us at HCA. So HCA is asking that you monitor those emails through which you receive communication with us so that you can respond to that quickly and effectively. And that if you get that and it may need to go to somebody else in your organization, that you forward that message to the person who needs it. And I think that also covers the how providers will be informed question. There is a question about hospital-based, and if that means freestanding psychiatric facilities are ineligible, even though they're contracted with the MCO and BHASO. Michael or Jason, would you like to take this one?
So Kim, I'm sorry, it was the hospital-based, is that what it is?
Yeah, it is that definition of hospital-based, and I can speak to it if.
So I think
if
where
you'd
we
like to.
landed on, oh, I'm sorry, I believe where we landed on that was if you are part of the hospital proper, then you are out of scope based on the language. If you have a satellite office that's off campus, not part of the hospital facility, then we are scoping you in. So I hope that clarifies that.
Michael, I might just add some additional specificity to that. If you're an off-hospital BHA campus, you are eligible. If you are a hospital, you are not eligible under the language of the proviso.
Thank you, Jason.
And I do see one other related provider question about RHCs, which I think I answered. Again, similar. An RHC itself would not be eligible unless you're also a BHA, again, doing that community behavioral health services, then you're definitely eligible. And then what I don't know, Kim, and maybe you have thought about what was it? Day services, day support treatment providers.
Do you support treatment providers? I think that would be a question, Michael or Teresa. Teresa, if you're on. I think for many of the types of services that are qualifying, right now we really know the high level. If you're licensed as a BHA, if you're submitting these types of, if you're submitting claims through MCOs, BHASOs, then you'll qualify. We are still internally working out a lot of the types of services that are being used to determine those client counts, right? Those polls, those internal methodologies. So that's probably still the answer to that question, is that it's still in review. One of the things is we're still working on daily.
There's also a question about, and maybe our finance team can help with this, in terms of using clients served as a basis. Why are we doing that as opposed to services provided? I think that might have, we are doing it based on sort of encounters provided, but maybe somebody from our finance team could clarify that.
I know Simone wasn't able to join today, but the thing that I would speak to on that is that we're actually actively using both. We're using types of services provided to determine the claims. So I think it's not an either or, I think we're using both.
That's my understanding too, Kim. I might just take a moment, a slight editorial here. This can get complicated very quickly, and the more complicated we make this, the longer it will be to get the dollars out the door. So we're looking to try to find an efficient, effective means, a fair, equitable means of doing this as quick, so it can be done as quickly as possible. So looking at BHA as a licensing is a very clear way of doing it, and then associating that with encounters and those fees paid in provider one, also a means of doing that. And as Michael showed, looking at those time periods, and you might want to just go back to that slide, Kim, because I do think that's a pretty critical piece for folks to understand. Looking at the 6 months of 2016 and the 6 months of 21, so you can get a fair perspective pre-COVID and post-COVID utilization-wise. And then again, trying to find a means for us to then use the P1 system data and client data and paid data to find a much more efficient way to get the dollars out the door as soon as possible.
Kim, I see thank you, Jason. I see a number of questions. I don't know if you're going in order or not. This slide has 19 and 21 on it. And I believe we're using the last 6 months in each of those years. So the question had to do with what time frame. The last 6 months in 19 would actually get us right before the pandemic. And then to get closest to this date, I believe would be the last 6 months in 2021, as I understand that. So I'm going to turn it back to you so you can kind of pinpoint us where we are on the questions. I know there's many in the chat. So
there's many questions in the chat and we won't be able to keep up with all of them, but one I saw and pinned for us to address are rural health clinics funded by Indian Health Services eligible? So potentially, right? If you are also licensed as a behavioral health agency, if you meet the criteria, then yes. And just, do we want to speak more to that question, Michael, Jason, Teresa?
I think we touched on it, Kim. I think, again, it has to do with BHA services. Again, that would be the critical factor. But yes, you're qualified if you're BHA related. Teresa, I see you on. I'm sorry. Did you have more to share there?
The only thing I would share is for those of you that are licensed BHAs, you're probably using the SERI guide. So that's key. So those service codes in the SERI guide are key. And then for those of you that may be a little unique in that you're a BHA and you might be a rural health clinic and you might be something else, you may be using the mental health billing guide part 1 or perhaps the SUD billing guide. So those are the kinds of service codes that we will be looking at. So as a licensed BHA, did you submit encounters and claims for those services outlined in either the SERI guide or the mental health billing guide or SUD billing guide? So those are the kinds of technical specs that would be in our data pool as we start to pull information. So I hope that's a little bit more helpful for some of you that are like, you know, where do I fit?
Thank you, Teresa. We have an additional question that came in about, can retention include recruiting counselors? They've lost 5 counselors due to COVID. Yes, absolutely. That's absolutely in line with the intention of these funds. And then another, I believe that client counts would be determined by provider 1 billing. Does that include MCO client counts? Yes, I believe that absolutely includes MCO client counts. There's a lot of questions about the slides. These slides will be posted to the HCA contractor resource, contractor and provider resources page. Outpatient BHA that opened providing services in 2021 due to the shortage of services available due to COVID. Increasing services is underway if they are able to hire staff. I think that question is really if they're able to use these funds to hire staff for that effort that's already underway. And yes, I think this is absolutely in line with the intention of the funds. There's a lot of questions about how we'll calculate the amount, and that is work that HCA is still doing and we'll continue to update you on. That's not information that we have to be able to share today. We can share that the amount you'll get will go out when you receive your contracts. And we won't have that for you before you receive your contracts, but we will continue to update you on our process. There's a question here that's interesting. In calculating payments to providers, are you giving weight to services provided in person versus services provided remotely? What about giving weight to services provided in home and community versus services provided remotely?
Kim, I think this goes back to Jason's point earlier. We are, although it may not sound like it, we're trying to keep this as simple as possible. And so the weighting between whether you're served in person or virtually and all of that, we're really not getting into. We're not going through an action or putting extra weight on individuals served based on how they're served, if that makes sense. So I don't think that's happening. I don't believe that will be happening.
I apologize that the questions are a lot to keep up with, and I'm sure I am in no way keeping up with your questions. So
and
thank
Kim,
you
I'm
very
trying
much.
to answer a few as we go too in the chat, so I'm trying to be helpful there. But you're right. There are a lot of questions, and they're very good questions. Thank you, everybody. And if we don't get to them, we're going to have this chat recorded, and we'll get to them. So we'll figure out a good way to do that.
And I think, hey, team, is there a way that we can just provide also a link to that proviso language? I think it's important that each provider actually go to the budget bill and read the proviso language for yourself to see how it is laid out. It does answer quite a few questions. And what I want to make clear to folks is we in HCA are really, really trying not to add anything on top of what's in the proviso language, which is why I want to direct you back to that. Because some of your questions about, is this going to be allowed? Boy, howdy, we don't want to stand in the way of some of those questions. So please go back and just use that as a nice starting point. We will get to all of your questions, but I think some of them will be answered by that.
Yeah, I think picking up on that, Carrie, there's several I see in here about can we pay for recruitment, retention, stipends, for this staff or that staff. This came, remember what Carrie initially said at the beginning of the call, this was providers saying, we can't serve those that want to come through our door because we're bleeding staff, we're losing staff, we can't retain them, we can't recruit them. And so this is that relief. This is getting resources to you so you can retain and recruit staff. That's paramount in this work, and that's kind of what's driven behind it. So the one question that came up too about, well, can this be retro? Can it be for things that I'm doing right now to recruit and retain staff? And the answer is yes, it can be. So it's pretty flexible that way, but remember the genesis of it. This really is about you being able to have people in your facilities that can serve those that are wanting to come through your front doors. So thank you, Carrie, for your remarks. Kim, back to you.
Yeah, I just want to stop for a moment. I noticed a point of concern in the chat about the fact that it may take us the full amount of time to roll out these funds. And I just think that that's worth a moment of noting that that's very heavy on our minds for every extra day it takes us. We're working very hard to distribute these funds in the most equitable way, and we're doing a lot of internal work on that. So Michael, Jason, Carrie, don't know if you have additional comments to add there.
Actually, as you were starting to answer that, I also added a comment, certainly understood that, Wendy, and agree and appreciate that. But as you can see, the volume of questions here, even today, it can get complicated. So we need to find a way to balance so we don't overcomplicate this, so we don't delay. But if we do overcomplicate it will likely cause us to be later in that schedule than we'd like. We're hoping to find a way we can do this sooner rather than later in that schedule, much sooner than the end of September.
Yeah.
And we have some experience doing this, something similar at least, at the end of 2020 and early 21, where we did do a much smaller amount of CARES Act distribution, but we did that pretty quickly, and I know we can do it. When Kim, and I do see a hand too, and I don't know, do you want to do hands, or do you want to finish the chat, or how you want to manage that?
Yeah, I think let's jump to hands. Julia, would you like to go? You have a question?
Yes, sorry, I couldn't unmute myself for a second. Yeah, thanks guys for putting this together. This is Julia O'Connor with the Washington Council for Behavioral Health. I know we have a whole bunch of questions that we don't have time for today, but I know in the past you've mentioned assembling an FAQ that would in theory be on the website. Are you still planning to do that?
Yes, thank you for that question. I think that we see from the volume of comment or questions today, and certainly those that have come to our inbox, it's very necessary and we're working on it. It should be posted. I'm going to give myself a deadline of hopefully end of the week, but definitely something we're working on because so many of the internal methodologies are still in a continual conversation. We've not posted it yet, but it is something that will go up with at least the information that we have for the questions we've received today.
Thanks very much.
I see a lot of great questions too about the use of these dollars. I just thought I'd make a point about that. The Medicaid restrictions and what is a Medicaid billable amount and what could be none of that matters here. So almost anything you would consider retention, recruitment, need to operate during this period would be eligible. Get creative, think about means of how you would do that, and it probably would suffice for this.
Yeah.
We have 3 more hands up.
Okay. 1 second, Kim. I'm going to try to address, I see a few tribal related questions. So go ahead and get ready to ask the next hand up. But on the tribal side, yes, you will qualify if you're a BHA. And we know there's a unique relationship between you and the MCOs and how you get paid and such. But you are in scope if you're a BHA and offering behavioral health treatment services. So I just wanted to make sure that we didn't lose you guys in the process here. Go for it, Kim.
Thank you for speaking to that, Michael. Katie, I see that you have your hand up.
Yes, I do. Can you hear me?
Yes, thank you.
Okay, perfect. Thank you very much for putting this together. I know that I think my question, hopefully other people have the same question that I have. So we are first of all, I work for the Fulman Agency in Burlington, Washington. And we are an outpatient treatment facility. And we provide SUD, mental health, co-occurring services, evaluations. So, you know, a broad treatment facility. So we are for profit and considered freestanding for insurance, commercial product. Do we qualify for this grant? Do you have to have a One Health or a Provider One contract? I guess that's would answer my question.
Yes, you do.
Okay. So a couple slides back, you had mentioned we also have a contract, you know, via the state of Washington for gambling addiction. So I just want to verify that I heard that correctly. So problem gambling services and support is not eligible. Did I hear that correct?
Correct.
Yes.
Okay. Because all right. So as far as the Fulman Agency is concerned, you know, being freestanding, if you don't have the Provider One contract, then we are just not eligible for a slice of this money.
Are you contracted with the BHASOs?
We are not.
Yeah, you would have to be contracted with a BHASO or an MCO.
And you would still need your Provider One contract as well. So it doesn't look good for qualification in that regard. Thank you, though. Sorry about that.
Well, no, thanks for a little bit of confusion because we do have a Provider One account via our targets
For
our gambling, but you had already stated
understand.
Yeah. Okay.
Yeah.
Well, hopefully that answered some of the other people who are on the line wondering about, you know, on the commercial side, freestanding. So thank you for taking my call today.
Thank you.
Thank you for your question. Dan, looks like you have your hand up.
Yeah, thanks. And Jason, I appreciate everyone and all your team's work on this. So just some clarity regarding the hospital-based language. So there's a number of freestanding psychiatric hospitals, you know, throughout the state, which, you know, we have our Provider One number. We're contracted with the MCOs, the BHASO, but we're not like a med-surg hospital, right? The freestandings. So I was hoping you could offer some clarity regarding what the freestanding psychiatric hospitals, if we qualify for this.
Yeah, Dan, thanks. And really, it's Michael and our DBHR team here. In essence, I think the difference here is that if you have a freestanding BHA a freestanding licensed behavioral health agency clinic, that the services from that clinic would be eligible, but not anything else. Does that help?
Yeah, so the inpatient would not, but like our intensive outpatient programs or PHP programs would be? Is that what you're saying?
Right. If you have a standalone clinic, a BHA out of hospital.
If you are licensed through Department of Health as a behavioral health agency, that location, that entity, that's what we are looking for.
Okay, and sorry, and then last clarifier, just because, so the increase in rates, as I understood, you said this is a bridge to that. So we will see that change in our rates. So I would presume that then that based on our structure, if we're impacted by that 7%, that's part of the eligibility, because this is meant to be a bridge.
I see your point. And I think you're making a excellent point, and I do believe there will be some eligibility differences between this $100 million and that 7% bridge. Speaking generally, this will be a bridge to the 7% for most providers, but it is specific to community behavioral health and non-hospital based in this proviso language. So there are some differences there, Dan, but thank you for that clarification.
Okay, I appreciate it. That's kind of where I was hung up on, was the fact that it was a bridge.
I understand.
Gotcha.
Yeah,
So
apologies for that overgeneralization earlier. Yes.
Gotcha.
Hey, Jason, it's Katrina. I would sort of direct people to, I mean, the reason for the exclusion of hospital-based services is the way the proviso is written. And so that's kind of what ties our hands in terms of excluding that group of providers.
That's right. Thank you, Katrina.
Although the clinic-based, like an intensive outpatient or PHP would, as you said.
Correct.
Okay, thank you.
Kim, do you want to pull from the chat or go to the next hand, Kim?
You know, we still have quite a few hands up, so we're still collecting chat, and Jason keeps responding to those. But let's go to Mary Stone Smith, who's had her hand up for a fair bit of time now. Mary?
So much. Thank you for doing this and putting this together. And I can't imagine what a mammoth job this is. My concern is, you know, in the slide, it really makes it sound as though this is based on the number of clients served, or at least very, very heavily weighted in that way. That, again, really leaves WISE providers in the dust. You know, if we have 10 clinicians, they can serve 100 families or 120 tops, and that's based on the state's model and the restrictions that we have. If you have 10 clinicians in a facility providing traditional services, they're going to serve closer to 600. It is like at least a 1 to 6 disadvantage for anyone providing WISE, and WISE has been underfunded for a long time. In the last distribution, we didn't even realize payments had come in because they were pretty small. So I would really appreciate you, even if it takes more time, going back and looking at that so that it's equitable. Because in this configuration, WISE would again lose out.
You know, Mary, we've looked into this. I may have to refresh, and I will certainly take that back and do so unless others on the line recall the specifics. But Mary, I thought we had double checked that, and
so what
we were okay.
No, actually, we had received some checks, like 17,000, a couple of checks and some other smaller checks. But so we did receive some payments. what I'm talking about is the proportion. So we received a very small proportion when I look at, talk with other providers and what they received. Ours was very, very small, even though we provide a tremendous amount of services. And it was, at the time, what I was told is it was because it was based on a methodology that looked at the number of clients served. And with WISE, you serve many fewer clients. It's like a
Okay.
treatment facility with a certain number of beds.
We'll take that back, Mary. I think I thought we had resolved that. Michael, do you know more on that one?
No, what Mary just said is what she's been saying all along, is that it's outpatient and residential, right? Outpatient, you can serve a lot of people. Residential can serve few people. So we have to look at how we're bucketing things. And Mary's been calling for a special bucket or a special consideration for WISE. We do see it as an outpatient service, Mary. And at this point, it is lumped in that way. But there are some additional tweaks we have to look at. And obviously, we don't have everything sorted quite yet. So we will take your comment back. I cannot make any promises, but we will take it back. And you've been pretty consistent about what you're asking for here. So
Thanks so much.
Yep.
Looks like we have one more hand raised to go to. Tammy Baker, did you want to ask your question?
Yeah. Can you hear me? Yeah. Okay. So I have a real concern about the time frame in which the funds had to be, cost had to be incurred. So we're just now finding out like what costs are eligible. We have not even yet found out how much we're getting, but yet we had to incur the cost prior to July 1st of 2022. So that makes no sense to me. We should have, you know, we didn't know how much we were getting. We didn't know what we could use the cost for. There was no money for us to use prior to once we get the money.
Kim, I'll take this one. It might have been what I had said earlier, Tammy. I didn't mean to confuse the situation. This most definitely can be used for money first, your costs going forward. We have been asked, what about costs that have occurred prior to July 1 of 2022? Can we go retro? And we said yes.
Gotcha.
And so,
Okay.
but no, if you get a check for 500,000 or 100,000 or whatever it might be, you most definitely can use it to help in your retention and recruitment of staff going forward.
Perfect. And then one last question, and that's related to how you're calculating the amount we will get for those providers in King County who submit their billings through the King County BHO or BHA. How will you determine those payments?
I don't believe we're prepared to talk about specifics of King County today, but we do believe it'll all be looked at in a similar fashion, that the data would be viewed consistently. And yeah. I don't know if anybody has any other answer to that, but
no, I think
it
that's
really
the right
won't matter how it came into us. Yeah.
Right.
Thank you.
Yep.
So we are winding down the end of the hour. I'm going to take one more question. It looks like Ahmed, you have your hand raised?
Yes. Hello?
We can hear you, Ahmed.
Yeah, thank you so much for putting up all this wonderful presentation. My question is, we have a community behavioral health agency established recently. You know, it was late 2021 when the agency was established after community went through a lot of challenge during the COVID-19. So, but we got our license January 2022, and the agency goal was to provide, mental health treatment, based on clients' culture and language. And currently, we are facing a big challenge to recruit mental health practitioners who speak, the same language and culture with that of clients. So, are we not eligible for these funds, to find talents and mental health practitioners who have who can represent the clients in their own context.
Yeah, I think that's right, Ahmed. Unfortunately, if what I'm hearing is that your services, even though you're established in 2021, you may not have seen individuals until 2022. The data will be pulled from 19 and 21. So data that folks who might just be coming on with new services in the recent months, like this calendar year, from what I understand, I do not believe that those would be captured. Therefore, there wouldn't be dollars tied to them. If the fiscal team or anybody else has a different answer, please let me know. But I think we're counting things that would have been counted, or counting things that would have been services prior to January 1, 2022.
I just want to highlight for Melissa, would you please go to our last slide for more information? I think that we are over time now, and I want to be respectful of everyone's time this afternoon. I know everyone on this call is very busy and facing a lot of challenges. So please, for more information, please email HCA DBHR information at hca.wa.gov. And then we will continually update the contractor and provider resources. We will post these slides to the contractor and provider resources. We will post the FAQ to that site, and we will also post the recording of this call today to that site. I know that there are hundreds, quite literally hundreds of questions we were not able to answer for you today. We will have additional calls. We understand the need, and please reach out to that email address with the questions that we were not able to get to today. And then I'll just open it up for anybody else with closing remarks. Michael, Carrie, Jason, thank you.
Just a ton of gratitude, and thank you for your patience. We really are trying to get this out as quickly as we can. Please watch those email boxes and respond quickly once you get them, so we can keep the process moving forward. Jason, Carrie.
Thank you.
Nope, just to thank you.
Great
Yeah,
questions, and really do appreciate it. Thank you very much, all.
Thank you.
Right.
Bye.
Bye.
Take care.